Welcome everyone to Building a Roadmap for Enterprise Data and Analytics. My name is Anna Topping. I'm the Coordinator of Programs and Membership Experience at Tech Birmingham, and I'm lucky enough to be able to work with the leadership team of Birmingham Women in Technology to make events like this happen. So for those of you who aren't familiar with BWIT, as we call it, BWIT is an organization, a community organization led by women within Birmingham's community to connect professionals in IT and tech in the area with each other. So I'll give you a brief overview of the event, and then I'll pass it off to Ronit, who is one of the women that leads this organization. But thank you all for joining us. We have Becky Patterson here with us today to give us a talk about enterprise data and analytics. And the flow of the event is just going to be Ronit will introduce Becky, and then there will be opportunity for question and answer after Becky's talk. But you are more than welcome to put questions in the chat or in the question and answer feature, and those will be covered after Becky is finished with the main content of her talk. And then we'll just wrap up, give you a couple announcements about future events and ways to keep up with Birmingham Women in Technology and send you off. So thanks again for joining us, and I will hand it over to Ronit to tell you a little bit about our speaker today.
Okay, great. Thank you, Anna. So welcome everybody. Just to introduce myself as well. My name is Ronit Ron, and I work for BlueCross BlueShield of Alabama, managing one of the IT departments, and work very closely with our speaker. So very excited to have Becky with us. Just to expand a little bit about what Anna said, the BWIT organization, is here to connect women in technology and those that are looking for entering the technology arena or somehow connected to it. We do have programs set across the year with 3 different distinct categories. One is speakers events, just like we have today with Becky on different topics in technology and in related fields. And we have a set of small group empowerment sessions where we bring women together to talk about some specific topics that they're interested as far as leadership or anything that women face in the workplace today. And then the last one is networking. So we do have networking events. We have had one in person last year. We're very excited about that. And we are looking forward to have the next one coming up in the next couple of months, and more details will be shared for that. So Becky Patterson is our guest today to talk about the roadmap to building a roadmap to enterprise data and analytics. Becky is a director of healthcare analytics at BlueCross and BlueShield of Alabama. She leads the healthcare analytics division and its mission to support data-driven decisions for our organization. The healthcare analytics division includes clinical and enterprise level analytics support at BlueCross, including care management, network management and design, corporate utilization, pharmacy, account support and consultation, quality, and risk. In addition, her division has responsibility for business intelligence, data management, advanced analytics, and data governance. So she's got it all covered for us. Becky built and executed on the data and analytics roadmap for her organization. A dynamic, strong leader with great vision, and she has great passion for developing professionals to achieve their sought-after career goals and skills. She holds a Bachelor of Science degree in Health Administration from Auburn University and a Master's of Science in Health Administration degree from the University of Alabama at Birmingham. Becky joined BlueCross and BlueShield of Alabama in 1999 and has over 23 years of experience working with healthcare analytics and clinical programs. Please welcome Becky Patterson.
Thank you guys so much. I'm excited to be here. I've been thinking about this for a while, and I can't wait to introduce you to some of the things that I am passionate about. And just to kick it off, one of them right out of the gate is anyone who's worked with me more than about a week knows that I love an analogy. I love a good analogy. And the reason that I love them, and I use them very frequently, is that when done right, analogies make complicated things really understandable. They're quick and they can be transformative. They can be grounding. They can help us lasso a very complicated concept and relate it to something that we're more familiar with. In that sense, I think analogies and analytics have a lot in common in that they can help us see relationships between what may seem like disparate ideas and how they really connect. So with that, today, I'm going to start off with an analogy. Make sure this screen's going to work for me. In my opinion, and this is something that I've used frequently, I think analytics is a lot like starting a band. If you said, hey, let's play some music. Immediately, everyone on this call today started thinking about the type of music, right? Some of you may have thought, if you were in the marching band, maybe you started thinking about the music that you played in high school. If you're a rock band fan, you might have thought about, pulling out an old guitar and getting started. And what we're talking about there is that's kind of the critical business step, the critical need, the critical first step in analytics is determining what kind of music you're going to play. You've got to understand the business need and ask that question to know how to start to build your band. If I'm building a marching band versus a rock band, the tools I need are different. The instruments are different. The sheet music's different. The costumes are different. I could start a rock band, I guess, with a trumpet, but it's going to be a pretty goofy looking sounding band, right? So putting those things together, understanding that business question starts to lead us to the things that we need to collect, establish, and use in building our band. And then finally, we've got to have a place to deploy that concert, right? My kid has a flutophone. Maybe together we could come up with our own band, but we're probably not going to sell out a stadium. Similarly, I couldn't take the $1 million band and put them in a listening room or in my living room. So understanding how you're going to get music out to the people who want to listen to it, how you're going to get data out to the people who need to make decisions from it, is sort of the critical foundation of building an analytics roadmap or starting a kind of an analytics team. The other thing I really love about this analogy is there's so much variety in it. What was popular on the music scene 100 years ago is not the same thing that we're listening to on the radio today. New instruments come along or new ways of maybe synthesizing the music. And the same is true with analytics. What was in vogue even 20 years ago when I started in this career is very, very different to the instruments, the tools, the technology, and the expectations that we have today. Another kind of pivot in this analogy that I think is really, really effective when we think about how analytics and music relate is not everybody's going to like the same type of music. I may have an affinity for singer-songwriters and jazz music, and if someone else has an affinity for, country music or, hip hop, what we need to play that music and what those expectations are different. And I have to tolerate in analytics that all customers aren't going to like the music I'm playing every time. And what satisfies one customer is not going to satisfy another customer. So there's just this constant growth. There's this constant evaluation, this constant innovation that has to exist in analytics, much, much like music. Just like an analogy, like I said in the beginning, analytics really has the ability to connect us and those disparate ideas. And I think at the end of the day, any connection can be so powerful. And I believe that's why analytics is everywhere. It's everywhere we turn today. We can ask any organization in America and they're investing in it, and they're investing in it heavily to the tune of billions of dollars a year. Colleges and universities are building out programs around analytics and certifications. It is absolutely one of the hot jobs. Every time I turn around, it's analytics or some derivative thereof is in the top 1 or 2 sought after jobs in the country. And this isn't slowing down. It's not going to slow down because the perceived value of analytics is at the top of mind. So today I want to kind of talk about what is that? What is analytics? What does that mean? What does that mean for all of us? And I can go out and find 1,000 definitions about analytics. And there's one on the screen that I probably lead with and use the most because it does imply the absolute importance on communicating patterns, improving decision making. It looks at and explains that some analytics are sort of rear view mirror, what's happened, why has it happened, the demographics of data, if you will, predictive, what I think will happen. Everyone's talking about data science right now, and that's definitely where that predictive and prescriptive space lives. And then of course optimizing the results, absolutely using the data. But to me, this definition is good and it works, but to me it's really much more simple than that. It's really about making connections, connections between questions being asked and the data that is available to you. The power of analytics are those two things with action. It's about decision support, and every one of us in our respective organizations have decisions to make. It doesn't matter what our role is. Having good information, having good data to support those decisions, I say, and I believe, is a universal need. So my goal today in this talk is really to create a better understanding of analytics, this mystery that we're all kind of talking about and running towards, and to get you thinking about the possibility of analytics at your organization, within your organization, no matter what your relationship is to your analytic team. If you're an analyst, if you're a wannabe analyst, if you're responsible for building the team, or honestly, if you're that critical cog we need in this wheel, which is our technical and business partners. We can't do this without that handshake and that connection. There are skills that we typically talk about in analytics. Again, there are tons of these: math, statistical principles, data visualization, etc. And for every skill I've listed here, there are easily 2 more that I could add in its place overnight. These things are important. They're really important. I don't want to say they're not, but I believe that it's also important to note that to be a good analyst, you don't have to be good or even experienced at all these things. I don't want you to believe that you have to go out and chase them all. In reality, I dare to say that if you found a magic unicorn analyst who could do all of these things, in and of itself, that doesn't actually mean that he or she will be a fantastic analyst, because I think it's more than that. I think it's the way we think and it's the way we approach our work. I do think it's important, though, to have a general understanding of these concepts and these skills that typically fall under that extremely broad heading of analytics. And just like there isn't that one finite or mandated list of skills necessary, I want you to also understand that there isn't one single path into analytics either. My own path into and in analytics has been unique and maybe somewhat of an accident. I say all the time, I'm kind of the Bob Ross of analytics. It's just been a bunch of happy little accidents to get me here. I'm not a technical expert by any means. In fact, my real probably only qualification is I'm a little bit nerdy and a whole lot curious. Even though I could say analytics was tugging at me in some form along the way, some failed stints at math and some other things, I technically didn't get into analytics until I was doing an internship here at BlueCross. I was handed, by chance and opportunity, and timing was right, I was handed a paper stack, yes, of data related to satisfaction and experience studies. And I was asked to analyze it and interpret it. I was asked to explain this data and put it into a format that I could share it with an audience of executive and physicians, and then help design the next study. Now I'm telling y'all, I was 22 years old, coming right out of school, and nervous as a house cat, but I did it. And so I was able to get in there and ask questions. Since I didn't know what I was doing, I had to ask a ton of questions. That project gave me extremely valuable experience that led me to another project and another project and another project. And before you know it, I'm here with you today talking about how to set up an analytics strategy for an organization. And in reality, I made it sound somewhat simple, but it was a very, very winding road. And I fell down and I skinned my knees a lot. And just like my story and just like my experience, there isn't a typical analyst or a typical background of an analyst on my team. And I'm so, so very proud of that. We've got members of our team with those degrees and backgrounds that you would expect when you think about analytics, maybe math, computer science, statistics, but also things that may surprise you. We've got registered nurses. We've got people who have psychology backgrounds, public health backgrounds, backgrounds in communication. Of course, my background is in health administration. Liberal arts majors. Man, liberal arts generate some awesome critical thinking power. So no matter what your background, this unique tapestry of perspective and experience comes together to form connections that really, really make our team a strong analytic team, in that we're diverse in our approach, our skill set, and our capabilities. So when I think about those skills that are truly required for a career in analytics, I actually think about behaviors and I think about soft skills way more than I think about that list of technical skills that was on my previous slide. All those soft skills that we celebrate in analytics really generate the behaviors, and they really generate the outcomes that I think make us unique and special. We celebrate things like curiosity. We celebrate things like the ability to participate in and see the value of a healthy debate, collaboration, the ability to listen and understand, listen to learn, a desire to find a yes moment, even when it's starting small to build momentum. We can generate so much thought with that yes moment by just welcoming that little bit of different voice. That's how we build momentum. That's how we ask questions. A focus on these skills, no matter what technical or applied skill you choose to train in, are imperative to being a strong teammate or a strong leader in analytics. So what I want to tell you is there's no one path to a career in analytics. There's not one roadmap for an organization or for an analytic program. And so I'm going to share with you today what we're doing. I'm going to share with you my story and our story and the path of analytics at Blue Cross. But I want you to listen with a sense of curiosity and think, how can I make that work for me and for my organization, no matter what your perspective is? There's not one way to do this. I want to introduce you to analytics now at Blue Cross. And Ronit did a good job of explaining kind of some of the thought process on our background. I will tell you one thing about our approach is we have a very strong North Star, a very strong compass, if you will, that points us to a mindset that data has a job to do. Supporting data-driven decisions for our organization is embedded in both our mission as well as our purpose statements. Our strategy and approach to our analytic infrastructure, the investments we've made, and the business relationship that we've fostered along the way has all been with that underlying philosophy of we are in the decision support business. Connecting data to decisions to be made, questions being asked of the data is really our philosophy. We did not get here overnight. I would like to tell you I had this grand plan worked out in 2008 to where we're going to be right now. But I assure you, it's been a very long and winding, sometimes bumpy road, because analytics is not a destination, and we're still on that path today. I realize that many of the terms and names on this list that I have on the screen are just company jargon to you. They're product names or product names that we came up with and we've used along the way. And they may not mean much to you, and that's okay. What I really want to emphasize about this and for you to take away is that we started small. We started small and we built on one success at a time. Our North Star, as I mentioned, has always been that data has a job to do. But we've been extremely flexible in building out this infrastructure, our talent pool, and supporting real-time business needs and relationships, and let that kind of guide our next best step. If we had a business need for one particular type of data set or one type of analysis or one tool to be deployed. We use that business need to generate and build up our infrastructure. We didn't set out and say it has to be done in this very stepwise logical approach or it won't work. It's most definitely been a tapestry or a quilt, if you will. We projectized items frequently and often, frankly, to kickstart and get the resources that we needed. In an ideal world, would I have liked to wave the magic wand and said, give me millions of dollars and give me 5 years or 10 years and this is what we'll build? Sure, of course, I would have. But the reality is that's not how we would go about getting funding and building growth. So we projectized, if you will, items frequently. We got those resources. We created start and stop dates. And this is what I see when I look at that screen. I see here growth. I see growth that was built on collaboration, growth that was built on this idea or this spirit of continuous improvement and customer and decision-making support. Data without action is just data. You're going to hear me say that a few times today. Data without action is just data. So building relationships with business partners, our customers, technical teams is critical to making the data usable and valuable to the end user. And that's what I see on this chart when I look at it. I look at the adoption of some of our products and applications. I look at the expansion of the functions and the teams that we support. And that's where I see our growth when I look at our relatively brief history in analytics. Though this hasn't always been this way, and I'm sure it'll change again someday, as of today, we think about our organization with sort of 4 key analytic functions. It starts with data or our foundational analytics. This is where we analyze, and when we think we're done analyzing, we analyze some more. It's the blocking and tackling. It's critical. It's where much of the deep understanding and knowledge of our data really begins. It's where we're allowed to be the most nimble, the most flexible, and ask the most questions. We then move into delivering insights via business intelligence solutions. Getting information to the end user is a critical step. Again, data must have a job to do. We govern that data. We want to ensure that the data that we are delivering is consistent and it's of high quality, and that people can trust it when they pick up a report from us or pick up a data point from one of our applications. And then, of course, advanced analytics is what everybody's talking about right now, and we certainly are too, but predicting what's next so that we can act on the data, predicting what's next so we can optimize the decisions being made or the behaviors that we want is really sort of the future of where we're moving. It's the so what, the next step in analytics. For our team, these are not silos. They can't be silos. These are functions and they have to connect for us to deliver high impact data to our business partners and customers. In a silo, this information would be pretty fragmented, and I don't think it would resonate as well as it does with our end users and our customers. Just like I said early on with my band analogy, the work that we do in analytics really starts with asking questions. By understanding the answers to questions, we begin to analyze and we begin to provide results in a way that supports answers. I know that data science and predictive analytics is all the rage right now, and we're investing in that area. We're geeking out about it. We think about all the possibilities also. We're definitely energized by the newness of it. But I think it's important to know and understand that the foundation of that work is based on the high volume and maybe not as highly complex blocking and tackling of understanding the data and what happened and why it's happened. Continuing with my music analogy, you've got to start playing scales to learn how to play music. Understanding the data, understanding the fundamentals is key. And it's really where the majority of the day-to-day work happens. We must understand our data. Understanding that data and asking questions of it is not a simple task. It sounds easy, but there are an infinite number of questions that can be asked from the millions and millions of data points that we all have access to. I think a myth about BlueCross data, and it depends on where you're at and where you're coming from, there's one of two things. Either we have only claims data, and that's what we're limited to using. And man, does that sound boring. Or we've got everything. We somehow magically know every single thing related to your health. The reality is it's somewhere in between. When I started at Blue Cross as an intern, we definitely were limited to pretty much raw old school claims data with what we were able to analyze. But today, in addition to various claims data, we also have access to lab data. We have access to some of the electronic medical records in our network. And we have some other unique data sources that really help us to inform the what and the why that our members are experiencing when it comes to their healthcare. And while this data is rich, and again, I think we've landed on a gold mine compared to where we were 20 years ago, I recognize that there's more data to be had. And we recognize that. So we're always looking for ways to connect more data, new sources of data in order to better inform our analytics and our partners. New data, such as understanding social determinants of care, that first one, maybe integrating a new predictive model. All of this allows us to go deeper, to ask more probing questions, richer questions, and revisit, and this is important, revisit conclusions that we think we've already made in the past. Not having data hasn't kept us from getting started. Not having the perfect data set shouldn't stop you from getting started. But get excited that there's also more. And that's what I'd tell you. Use the data you have. It's never perfect. Don't be afraid to get started, but balance that with closing those data gaps and enriching it. Think about what you can learn that you think you already knew. When I talk about more data, I talk about closing gaps and making sure we never kind of look for that confirmation bias, right? This is what I think I know. I got some new data. Oh, great. Now I know something else, or this informs a richer decision-making process next time. I think I'm going to use some real world examples here, but there has been really no better example. I couldn't have designed a better example of the idea of supporting decision making, unexpected decision making, I might add, and not being able to wait for the perfect data than what we've had recently all experienced with the COVID pandemic. As a healthcare company, we had questions coming at us left and right with a new spin absolutely every day. It was understood quickly that the years we spent as an analytics team cultivating relationships and the data infrastructure we built was going to be critical in supporting our numerous partners in this COVID crisis. Our numerous partners, including physicians, employer groups, internal customers, our senior managers, our members, etc. We were getting hit daily with questions such as who's been diagnosed with COVID. That sounds simple right now because there's codes in there and it's easy to kind of track that, and we all see it on the news every day. But in the beginning, remember, there was no codes. We were looking everywhere. We were looking in lab data, talking to hospitals, combining diagnosis to see if we could figure out where this pandemic was actually starting. Predicting who was most risk for COVID. We knew comorbidities and age definitely contribute to higher complex cases. So trying to get in front of those members and talk to them about preventive measures was a critical question we were asking. Monitoring COVID just for the impact of utilization overall. I mean, did any of us ever expect to experience a time where the world shut down for a little while? That changed everything for us. It changed our benchmarks, it changed our norms, it changed our expectations. What programs did we need to implement to ease the burden from COVID? Most of us on this call had probably never had a telehealth visit prior to COVID, but now most of us have probably had one, maybe of some sort, or we definitely know someone who has. That was a new thing that we had to start looking at, dissecting, and analyzing. And then finally, how could we optimize the vaccine adoption? Again, even this question seems simple, but it changed so much over time. In the beginning, there was a limit on the vaccines available. And so trying to maximize who is most at risk and who needed it. Lately, it's been more about different age groups, maybe different supplies, who needs that booster, et cetera. So these things have changed over time, and we've had to be really, really nimble. And we will continue to be nimble. I talk about it like it's in the past. I don't believe it's in the past, but things are going to change. Just today, we're talking about, okay, what's the next step with long COVID? How do we start to analyze the impact that COVID and people with COVID have had on other comorbidities? It's been a really good, never-ending opportunity for us, if you will. One thing about COVID, though, that was really unique, besides it was fast and flexible and unknown, is that we all had kind of that, all those stakeholders I mentioned, we all had that sort of overlapping biggest issue focus. Never in my career have I had a situation or the luxury, if you will, of everybody, all my customers kind of facing that same unique thing. Like COVID was the biggest thing we were talking about. In a typical situation in the real world, norm times, whatever you want to call it, the business questions and the maybe what's top of mind, the decisions to be made from our various customers are honestly as diverse as the patients we serve and our membership. So I'm gonna take a second to shift gears here, away from COVID and away from our past and away from our setup. And I want to actually share with you some of the ways that we support our customers every day. Before I do that, though, I thought that I would show you a brief video, give me a chance to take a sip of water. I think it's important for you to hear directly from the individuals we support, so you can hear how the data that we provide informs their decision making. Because again, like I said, it's about connections. It's about connecting questions to data, and it's about supporting decision making. Let's see if I can make this work.
So it's something that enables us to be able to see what the patient needs, not only what they think they're there for that day, but the ability for us to troubleshoot and maybe make sure that they're caught up to date on all their primary care and preventive services.
As soon as COVID kind of kicked up, we were scrambling, much like every other state agency and every other organization. We kind of didn't know what was going on, and we decided we wanted to keep a very close eye on our claims data, and Insights was great for that. We decided we wanted to start looking on a weekly basis at all of our medical and our dental claims. So Insights is very user-friendly. You go in, you click a tab, it takes you to where you need to go. I put in the dates that I want the claims for, it spits it out seamlessly. So that's been a great tool that we've utilized this year alone.
An ounce of prevention is truly worth a pound of cure. And if we're able to identify areas where patients are lacking in screenings and primary prevention, we can actually do something about it and fix the problem before it even occurs.
We use it every day. Like I said, for our weekly claims, we plan to keep utilizing that tool is for the foreseeable future. So it's been invaluable for this year alone.
But it's the ability for you to give them information to be proactive about their own health. In turn, as it helps you, we have seen our reimbursements improve, not only because we are closing gaps, as you would call it, with Blue Cross, but also providing services that those patients need. And so this is one example where we're able to be proactive, and the insurance company is giving a tangible reward for doing those things that we really should be doing already anyway.
The customer service with Blue Cross has been great. Anytime we have a question, we email it to our Blue Cross rep. She gets back to us the same day, almost every time. If she doesn't know the answer, she lets us know, and she lets us know that she's investigating it, and we will get an answer. So I can't say enough about the customer service we've received.
When you have a company that partners with you to help take better care of patients, it definitely makes you feel like the insurance company cares about the patient, and that's someone you want to cooperate with and work with. Blue Cross has equipped us to be better physicians, and it certainly makes us appear smarter and more on top of our game to be able to go into a patient room and say, hey, I know what you need and I'm here to help you get it.
You heard Dustin in that video, and I love that video, but you heard Dustin talking about Insights. Insights is our what we believe is best-in-class reporting tool that we built and deployed back in 2019. We've had dozens of releases since then, so it's most definitely not the same tool that it was then, but it continues to get better and better. But what I love about that tool, what I love about this tool, is the history of it. We listened to our customers and we asked really hard questions. And honestly, we took some pretty constructive criticism and feedback about the analytics that we had provided in the past. But we listened, and we designed the tool to meet their needs. That collaboration, that asking questions, then finding the tool, then knowing the venue that we want to deploy to, is what makes that tool so valuable for Dustin as well as some of our other customers. There's a similar story with our physicians. Busy practices are oftentimes, because of various data sources, people going to different places, they don't always have a better picture or a big complete picture of a member's health. You think maybe they do, but they oftentimes have a big kind of gap of knowing what's going on around them in other physicians' offices. So we designed our PMR tool to provide that member level data to physicians to support them in treating and caring for their patients, our members. Dr. Yeskis did a fantastic job of describing how critical this is in her practice. Again, a decision to be made at a critical point in time, the data having a job to do and serving it up for her at just that point that she needs it to aid in the decision making. And, while those are all external builds, we also spend a large amount of time and resources supporting our internal teams and decision makers on behalf of our members. One place we've done this is by creating a full understanding of our member interaction, engagement, and costs over a period of time. And Ronique and I actually partnered in the beginning on this vision to get the resources we needed to make this a reality. This allows us to measure the impact of our various engagement activities. For example, from the data that we have, I know that 18% of our members, when they are engaged via a preventive postcard for, say, breast cancer screening, has a positive health impact. They go and do that action that we called them to. That's compared to 62% of the time it working when it's online. Knowing that difference really informs a very real and tangible way that we can deploy resources to engage our members. Bringing that back to my music example, and like I've said multiple times, to make that data beneficial, it has to generate an action. I'm going to walk you through the concept of data generating an action at the individual member level. So another music example, we'll use Apple Music to keep it simple, but Netflix works the same way. They do a fantastic job of taking my music preferences, saying, hey, based on what she's listened to before, she's likely to like, singer-songwriters or rock band. They contextualize that data really well and say, hey, she listens to jazz on the weekends. So when I pull that music up on a Sunday morning or ask Siri to play music for me, she suggests jazz music, kind of puts that predictive context into play. And the course action, just using that larger data set to try and say, hey, why don't you buy this album? And, while maybe for us a similar scenario is maybe not quite as exciting as a new Taylor Swift album dropping, I can look at something like diabetes for us, right? I can say based on a lab value, this person could be a pre-diabetic or could be approaching that place. And so with some context, if they're on my Blue Cross, maybe suggest a care reminder or push to them a little nudge to schedule that appointment with the primary care physician. Or even go ahead and route that option for them. So based on their medical history and the gaps we have, instead of routing them to a traditional customer service agent, maybe we take that next step and route them to a health specialist that can go ahead and address that, making the data work for our members. So I've said a lot today, and I've shown you a lot. And I hope, honestly, if nothing else, you've learned that it's a really, really exciting time to be in analytics. There's no one way and there's no right way to get involved. I think I've said that to the point you're probably tired of hearing it. But there are some, what I believe at least, are universal things that connects all analytics. So just to kind of recap on those, we must reconcile questions that are being asked by the business or your partners with the kinds of data needed to deliver answers. It's sort of that simple. we have to ask the right questions. What problems are we trying to solve? What's the job that that data has to do? The second thing is we have to look at the data that we have. Don't wait for data to be perfect. Keep moving forward and build it as you go. Don't limit your questions. Don't limit your view to the data that you have. All that will do, if you think about the possibility of more data, possibility of more questions and more answers, it will generate curiosity, and it'll generate those yes moments that I talked about earlier. You can think of projectizing your data to the point of maybe getting it started, but I want you to think of data more as a product in terms of thinking about momentum, thinking about that constant desire for betterment, continuous improvement, customer support. Said another way, don't build something and just put it on a shelf. Figure out how to transition your data in such a way that there's an ongoing value that you can build upon. To the end user, but also, to you guys as analysts or to your technical partners, et cetera. Future-proof analytics by generating collaboration. Future-proof analytics by thinking about continuous improvement. Analytics rarely should be one and done. And then finally, people, behaviors, relationships, collaboration, curiosity, problem solving. Analytics cannot operate in a silo. It is best seen as a partner on a team. You are limited by what one person can do. You're limited by one instrument. So think about how to bring that tapestry of experience and perspective together. All right, so taking my own advice, put together this presentation, and then I asked my associates. I asked maybe 8 to 10 of them to just kind of give you guys some advice, what some thoughts they had. I wanted to get some more data on where we were headed. And so I asked them a series of questions, and I'm not going to read all these answers, but I asked them, what's one trait? One other thing about it. Some of these associates had been with us maybe a year. On the max side, I think I asked a gentleman that's been on our team probably 12 plus years. But what is one trait that you think is mandatory for someone to be a good analyst? And you can read these yourself, but contextual curiosity, be curious and open-minded, have humility. You can't know everything. I love those answers because they tie back to some of those behaviors that we really celebrate that I talked about in the beginning. Similarly, I asked them, are there any words of wisdom that you go back and tell yourself on your first day of working on our team? Similar answers. It's better to err on the side of asking questions. You're going to make mistakes. Ask questions, learn, take constructive criticism, give yourself grace and space to learn, ask questions, ask for the backstory. There's hidden knowledge, ask. And then I love this, spend time outside the data and the tools to learn about the business. What I think is interesting about both those questions is, to a T, not one person said, man, I wish I knew more statistics, or I wish I'd spent more time learning a tool. They thought about the behaviors. They thought about those soft skills that every one of us has that we can start working towards in terms of partner with our analytics teams. And then finally asked them, what do you think? And this is me bragging a little bit, but what do you think sets us apart from other analytics organizations? What do you think is our competitive advantage? And they talked about collaboration. We talked about people. We talked about cultivating each other, asking questions, making it safe to learn, be creative, make mistakes, ask hard questions. That all sort of goes with that same theme that I was talking about, which is try, get started and try. I love the consistency of these answers. And I promise you, I did not plan them. I promise you, we had the vast majority of these slides together. I just took my own advice and made sure that I didn't get a new set of data that confirmed a bias that I had. I love that no one mentions experience, like I said, and they focus on those soft skills. I had a perspective, and this really just kind of helped me to double down and seek down on some of those conclusions. Analytic skills are important. Analytic skills are important. So don't leave here and think I said you don't have to go learn how to do data visualization. But they're not much without this corresponding behavior, and they're not much without action. Data for the sake of data is really not that valuable at the end of the day. So for me, guys, be courageous, be humble, Have humility and leadership as a teammate. Build a team of people that are smarter than you, or at least smart in a different way, more talented or different talented, different experiences. They're going to bring a tapestry. They're going to bring up experience. They're going to be greater than the sum of your parts. Have humility in asking for that. Operate from a place of abundance and not scarcity. There is more than enough work in analytics to be done. There's more than enough ideas to be had. There's more than enough questions to be answered. And there's more than enough data to get started. So say yes. Say yes to sharing. Say yes to trying. Say yes to participating. Saying yes to new ideas. Saying yes to falling down and getting back up. Say yes to new people. Say yes to being coached. Say yes when it comes to analytics. Data has a job to do. Decisions can be in the macro, like we talked about with a physician in our customer groups, or they can be in the micro, that nurse on the phone with a member that has that split second to decide what care gap to suggest that they close. By understanding the why someone is asking for a piece of data, or the what they're trying to impact, that will lead to success, because it'll lead to positive relationships, positive connections with the person on the other end. To go back, be flexible, be creative, be okay with change. I can't tell you in my 20+ year career how many projects that I have started, I birthed them, and then I killed them. Their time had come to an end, and I'm okay with that. I can also tell you, for every one of those, there's been probably 3 times that I've started, and it was my pride and joy, and I handed it off to somebody much more capable than me. And man, they ran with it, and they made it better than the sum of their parts. I'm proud that I was part of kicking off some of those projects as an individual. I'm proud of my team as a leader, but I'm more proud that the decisions being made and the value we're supplying to the end user are greater than the limitations that I had in the purview that I had when it was my project. So be flexible, be okay with change. And then finally, pick your instrument, pick your tool, pick the style of music you want to play, and get started. Don't be afraid to collaborate. Don't be afraid to change up your playlist. Try something new. Not everybody's going to like your music. That's okay. Try something else. Everybody's talking about data science right now. Everybody's talking about AI, predictive analytics, you name it. And we are too. Trust me, we are investing in that area just like everybody else. We love to talk about it and get in the weeds, but data literacy is developed in descriptive analytics. What's happening and why, and the large majority of the daily work is done there. So don't be afraid to start there. Maybe it's not as in vogue, but it's the basics, it's foundational, it's critical. It's the scales to your music. It also generates questions and trust. And at the end of the day, that's what's going to drive analytic adoption. Thank you guys again for letting me be here. We are going to turn it over for some questions now. Hey, Ronit, you're breaking up on my end, so I'm going to jump in with what I see some of the questions being, and hopefully that works out. Be flexible, like I said. Are there any parts of you and your team's work that have made use of AI for analyzing data and making predictions? Say, what kind of pitfalls have you seen come out of it, and what kind of positives have come out of it? I think I mentioned some of the, I mentioned that call routing example. That is real. So today we've got a series of algorithms that say this person has a need, and we predict they'll respond. And so if you call in and you're on that list, we'll automatically call route you. That's just a kind of one really simple working example. We've got some others where we're trying to predict ER utilization, et cetera. I think the pitfalls is the questions that you ask in predictive analytics have to be much more specific. You really have to think about the action in maybe a much more targeted way than when you're just kind of looking at descriptive analytics as a whole. So getting your business partners or people on the other end to think in that sometimes tiny box is hard. And I think for us, it's really making sure we're asking the right questions. There's a question about, is data used in your organization aggregated so that individual medical data is protected per HIPAA? Yes, we follow HIPAA. If anything, we are overprotective of data around here. My team has access to a great amount, as you would expect, but we take that extremely seriously to protect it. Is the Insight tool available to individuals? No, the Insight tool is designed for the groups. It's designed for our customers. Same with the provider tool. And then we've got an internal version. External, we've got numerous applications where some of this data is presented, but it's used by the customer based on, I guess, their perspective in it, if you will. And those are all HIPAA protected as well. So only groups that are called self-funded has access to that by law and legally. And we go, again, the extra mile to protect that. And then I see one that says, what high-level example can you share to illustrate a problem that data analytics solved for your organization, uncovering the situation encountered, the actions taken, and the results achieved? Gosh, there's a ton of them. So, you know, I think probably some of the more unique ones are things where maybe we're stopping a behavior that's not warranted. For example, I want to believe everybody's a good guy and everybody does the right thing, but sometimes, you know, you can find things in the data that were billed maybe at a volume of 2 and it should have been 1, some things like that. Those are some examples of some of the kind of more exciting things that we've been able to stop. I'm actually personally more excited about situations that are we've been able to steer and predict. So that call routing program that I talked about, every bit of that is baked on data. We run information that we call CLIN tags on a nightly basis for some of them, and they generate behaviors throughout this company. They generate consistency. Same information a physician sees is the exact same information about me that maybe our customer service agent would see, presented in a different way, but it's the same underlying data. So the excitement of that really, to me, is kind of a takeaway on it. We are looking at some new data analytics tools. In fact, we just got one. I'll be honest with you guys, I was very deliberate not to name tools today. And the reason for that is they're numerous, and I think you have to determine what's best for your organization. I absolutely had no desire to be a commercial for my vendors today. What's the best tool for my organization might be the best, different for yours, for resources, the skill set you have, tolerance, risk tolerance, etc. So we are, and I'm happy to talk about those maybe offline, but I just didn't want to be a commercial for a technical organization, to be honest with you. Let's see, I'm still looking. One of the best ways that we've found to increase data literacy in our organization is we have implemented over the last couple of years. One of them is just being a partner, is showing up with the data, not just giving people kind of the short order cook yes or no answer that they ask for. So that's part of it, is just being transparent. But the other thing that we've implemented and done is we've got a series of meetings, and this is a place where COVID and working from home has been our friend, because it's allowed us to expand the audience. But we brought folks in, and we bring folks in on a regular basis, on a monthly basis, for a different topic, and we take them through the data. We deep dive, we let them ask questions. We're not critical if the question doesn't make sense to us. We are appreciative of the viewpoint, and then we bring it back and respond. Data can feel overwhelming, but you heard Dr. Aiskis talk about it makes her feel smarter. We really, really do try to present data in a way that makes it not prescriptive, that you only have to do things one way, but makes people want to learn and question and partner with us to get that information. And then I think this is the last question. I'm kind of all over the place without a host. Hopefully I got this going on right. I have a background in customer service, medical administrative assisting, and software development. How can I utilize these skills? Man, that's a great skill set, right? So you're used to thinking about questions. You're used to thinking about the decisions that need to be made. I honestly think you could do a whole lot with that. The key to that to me would be finding a data set to get started with that you can start asking questions of it, but thinking about the people that you supported on the other end of that customer service call, for example, or that billing call. There are definitely volunteer projects. There's tons of things you can do online, open source data, etc. Again, there's free tools too, but the key there to me is to find a question or find some data that you're passionate about, and don't do it from a place of confirmation bias. I can't emphasize enough, don't go looking for data to confirm your bias. Go look for data that you don't know what it says and start asking interesting questions, and then ask yourself, well, what about? And layer some more data on top of it. That practice will train your brain and train those behaviors that are really going to be critical. And then when you go to interview and you're lucky enough to interview for whatever it is, and don't be afraid of an internship, guys. I love interns. When you go to do that, share the excitement, share how you went about approaching it, share what you learned. Don't focus on the fact that I use an XYZ tool and I clicked here. Talk about what you learned and experienced and what made you want to go and find other information. All right, I think I'm at the end of my time, so I'm going to pause there. And I'm going to turn it hopefully back over to Anna or Ronit.
I will wrap up for us today, but thank you to everyone who came. Thank you so much, Becky, for both the presentation and your answers for the questions. I definitely learned a lot, and as a byproduct of being involved with this, yeah, we're really appreciative. And for everyone that's still on the call, there will be a recording of this posted to YouTube. So you'll receive an email tomorrow as an event recap with that link. So you'll be able to watch it back or share it to whoever might be interested in this as well. And as Ronit said earlier, BWIT does plan on having their next event be an in-person mixer of sorts. So there are details to come on that in the near future. So keep your eye out for that. But thanks again to everyone for coming, and have a great rest of your week.